Hi, Anne. Welcome to the show. I'm very excited to have you on today.
Thank you, Dr. Laura. I'm so excited to be here. Thanks for having me.
Yes. So today's topic is about how you can't heal a body that you don't love. And so I would love for you to share with the audience a little bit about your backstory, about how you became an expert in body image, um, you know, an expert in the body image world and a certified intuitive eating counselor. So I would love to just hear more about how you kind of went down this journey.
Yeah, I thank you for that because I think a lot of times our past leads us to our purpose. And so I spent decades basically hating my body.
Wow.
And because of that, made choices and decisions that weren't helpful for my health, my overall health and well being,
Yeah.
my mental health and my physical health. My self talk was horrific. And I really feel, I'm a mom of two daughters, and I feel for a period of time when they were growing up that I did a disservice because I didn't know the impact it would have, the way I talked to myself and the way I showed up and, the different things that I didn't do, like not eat the birthday cake or, some of those little, nuances that you don't think about until you're out of it. And it was
Right.
really finally when my body broke down that I knew I had to do something different, and completely changed the trajectory of my career and said, "I have to heal myself and then figure out how to help other women specifically."
Yeah. Well, I mean, I think that's so true. I think like our history and our past does help shape and give us a purpose, right? And then if we're ready to embrace that purpose, we really discover how we can serve at such a high level. And it's through that pain and that personal experience, right, that you have empathy and knowledge to share. And it sounds like I know eating disorders can impact men and women, but you specialize with working with women,
Mhm.
right?
Yes, I do, yes.
And being a mother of 2 girls also is very impactful because I think you're right. As moms, we do model body image, especially for our daughters. And it could be the talking. I mean, I even growing up, I know I would hear my dad make comments about my mom gaining weight, stuff like that, right? That shaped me as a young girl, right? Being in that environment. So it really does, and now with social media, we see an
Right.
even bigger impact on young girls and tweens and teens and how they feel about their body and their image, because they're comparing themselves to really, women that are, you know, uh, not realistic.
Correct. A
Yeah.
lot of the paintbrushing and airbrushing and things like that that we don't even know what's real anymore.
Right.
And
We don't.
and and I think AI is even gonna make that more prominent, and so I wanna just highlight what you said about your dad speaking a certain way, and it doesn't family members can say things harmless, feeling harmless, but yet we take it in and we understand, so it starts to give us a perception of, well, that body's not right,
Mm,
and so my body must not be right.
mm,
I think like, even, I use the example of my mom saying to me, "You really shouldn't wear stripes horizontally because it makes you look," right? Or my dad saying, "That does not look good on you. You should be wearing something." Those kinds of conversations that
mm.
happen around the house, and then we just internalize all those messages, and then that becomes our story.
It does.
Yeah.
It really does. It can be very, like you said, kind of something. So I think it's an awareness as parents that everything we say and do, like the fact that I remember my dad saying that from, 40 years ago is pretty amazing, right? Like, I don't remember everything that came out of his mouth, but things like that. And my mother's embarrassment and shame in reaction to that, right? Because my dad did work out 5 times a week. He was very fit and he took a lot of pride in his body. And my mom, after having children, gained weight and never lost it, right? Like she was always had a little extra that she was carrying. So she would have that contrast that she was
Mm.
holding on to. I'm sure it wasn't helpful for her self-esteem.
Yeah, it damages not only her, but then the way she kind of feels about herself. And so shame is such a big part of body image. We don't say or we don't share those kinds of things with other people. We're very good at talking negative to ourselves and beating ourselves up and telling us what we should be doing and what we shouldn't be doing. And I can't believe I did that. And all the different language that we do to ourselves. And yet we would never say that to our best friend or any other person. We just say it to ourselves. And so there's this disconnect there a little bit from how we talk to ourselves versus how we talk to our friends and other people. And so if our kids are listening, they're hearing some of those internal messages too and seeing our actions. I remember trying on clothes and taking clothes off. And the way we take clothes off because we don't want to wear it because it doesn't look right can be just as impactful as words. You know, our the way we interact with our bodies, with our clothes, with ourselves that way as well.
The way the clothes that we choose to buy, right? Like
Mhm.
how we dress ourselves. I do even man, this is really I'm having some flashbacks now. I remember being in 7th grade and, my mother was dressing me in clothes that were too large for my
Mm.
size. So it was, like, baggy, the shoes I was wearing were too big. Like, it's really weird, and it really wasn't until I was, like, I don't know, maybe chiropractic school, like, it was years later, and I was like, "Oh, I'm not a size 7, I wear a size 6 shoe."
Isn't
Isn't
that
that
so
weird?
funny? Oh gosh.
I was like, "I
And
actually am not a size medium, I'm a size extra small." Like, it's really, really interesting how and I guess my body did change a little bit over those years, right? But my point is, like, I definitely was not wearing the right clothes when I was living at home and, like, going through puberty, right? And there was a lot of, like, we have to cover her up.
Yes.
My mother's I'm realizing now my mother's shame that she was, kind of, expressing onto me that I wasn't even aware of.
You know, it's interesting because I think back on my youngest daughter, she went through a whole phase where she wore this big, huge sweatshirt for exactly that same reason, wanting to hide her body, and
Mhm,
us having some conversations, and she just was, "No, this is." And she probably saw me wearing all big clothes because that's just the way I was. I didn't like anything too tight because I
mhm,
was still self-conscious about my body, and so
right.
everything was big, and so she just kind of took that as, "Oh, that must be the way you hide your body."
Right. And also, like, I think even as I think about my mother's Catholic upbringing, we have to cover and hide, not just because we don't love our body, but because we don't want men to look at our bodies. We don't want to be judged by other people. We don't want to attract attention
Mm.
sexually, right? I think there was a component of that as well.
Yeah, all so many messages that we get when we're young, and then we just think of them a certain way, we interpret them ourselves, and I think a lot of that has to do with, in my book, I talk about the seeds, you know, the messaging seeds, the belief systems that we are given. You know, we're given a belief system around what a healthy body size is and what bodies should look like.
Mhm.
We are given, um, a belief system around food and eating and around exercise and movement and around stress, and then on the other side, we are given this information around emotions. You know, don't cry, don't be too loud, don't get angry, you know, be a good girl. And so it's very interesting and confusing for a young girl specifically. Just well, I was a young girl at one time and I'm a woman. So I think about how impactful all those seeds are and then how we just kind of continue to believe that that's true, that those beliefs around body is that's the way I'm supposed to be. That's the
Yeah.
food I'm supposed to eat. That's the way I'm
Mm.
supposed to exercise. This is the way I'm supposed to act. All of those things.
Right, and it's also very cultural dependent, right? Like we see in different cultures, they value regarding women's bodies, they value different aspects. So even from one culture to the next, it could be a girl or a woman striving for this other type of ideal image, right?
Mhm.
And that's like all the other women around her, they're all like moving towards that. They're doing plastic surgery. I mean, do
Mhm.
you work with women that have done that to like change the way their body looks because they hated it so much?
Yeah, the negative self-image, they will do anything. You know, I usually work with women more along the weight side because
Okay.
they don't like their weight, but it's all the same thing. I don't like how I look. I don't look right. What's my avenue to fix it? You know, so a lot of times I'm working with women with extensive dieting history,
Mm.
yo-yo dieting up and down the scale, and extreme negative self-talk, you know, critical, judgmental, comparison, very mean to themselves,
Yeah.
and have a really hard time getting out of their own way.
So if a woman's listening and is recognizing that she's been a bully to herself and has been beating herself up for many, many years, and like a lot of that is like our subconscious mind, right?
Mm,
How do you silence that inner critic? How do you recognize number one that it's there, and then number two, change those thoughts? Because especially if a lot of the thoughts might be unconscious, we're not even necessarily aware that we're thinking this way about ourselves. And to your point, many women would never even say this to a girlfriend or sister or a loved one. They would never speak to anybody that they love in the way they're speaking to themselves. Right. So,
mm,
what we're really talking about is creating a self love relationship with yourself.
right, you know, and you hit the nail on the head when you said that internal voice that we're not even aware of, and we have to become aware of it. That's really the first step.
Yeah.
And I always think about awareness being the first success. So, can I be aware of my negative critic? What does she say? When does she show up? Or he, right? Can
Right.
be all different types of voices. I often ask, well, whose voice is that? So sometimes it's someone else's voice, you know.
Oh, a
Um,
parent.
yeah, my husband and I have a really great relationship around this because we've done some work together around it. And so every once in a while, and this is a joke now, but every once in a while he will say to me like, "Oh, hi Chuck," because it's my dad's voice that's coming in that I'm speaking with. And it's very interesting. And it's like a perfect checkpoint for me to go, "Oh, yeah, you're right. That's an old story."
Mhm.
So it is this awareness, and then once we're aware, how do we take action? How do we start to create a kinder voice? And many times when you talk about the inner critic, there's a conversation around self-compassion. We hear a lot about self-compassion. The problem is if we are constantly negative and have been negative for decades, self-compassion can sound really kind of funny or not believable. And so I
Fake.
bel yeah, exactly, you know, fake it till you make it. Well, that might work for some people, but there's a group of people that it's not gonna work for, and I think about there's a bridge between self-hatred and the self-critic, the inner critic, and self-kindness and self-compassion, and I think that curiosity is a great avenue to start changing the way we talk to ourselves. Can I be more curious about my negative voice? Where did that negative voice come from? Is that negative voice really telling the truth? Would I say that to a friend if she said that out loud? Like, let me explore this and be more curious around it and non-judgmental to see if I can start to shift the language a little bit so that I'm not beating myself up so much.
Right. And do you find that women that have done a lot of yo-yo dieting, they're up and down in their weight, they, in general have this inner critic that maybe they have not really actually identified until they start working with someone like yourself, but that inner critic's been there for a while?
Mhm, yeah, and it's beating them up because they've gained weight, right? And the reason for the diet is usually because I don't like the way I look. It also could be I don't like the way I feel,
Yeah.
right? And so we have to kind of split that apart and understand where that's coming from. One of the first, uh, activities that we do is how do we separate our worthiness as a human being from our weight on the scale?
Mm.
And that pull apart can be a great starting point to see, okay, how do I see myself? How do I think about myself? How do I talk to myself? how do I treat myself? And then with that, we can start to go, well, usually, excuse me, usually if I'm talking negatively, then I'm not treating myself very well either.
Right.
It kind of goes hand in hand.
So that's a really good observation. And so a big part of my podcast with Well Justin Mama is mama self-care. And we
Mm.
recognize the more that we do care for ourselves, that is a form of self-love, right? That is really nurturing and caring for ourselves as a woman and as a mother. And why that's so important because as moms, we're caretaking and caring for so many others that we have to fill our own cup first, right? So I think that's a good awareness for women that are feeling really depleted and burnt out. Um, and they could be these amazing caretakers, but they're really not putting themselves first. So they could start to recognize if there's an inner critic there that's maybe even judging. Because I do hear this sometimes from women. Oh, I'll just, let me take care of the baby right now. And they put themselves like in the back burner, right? And this is like
Mhm.
soon after giving birth. And it's like, no, mom, you just gave birth. Your body's recovering from pregnancy and birth. And you deserve to be cared for and nurtured as much as your newborn baby does.
I think that's so true, and it's unfortunate that that's the way moms feel, especially right after birth,
Yeah.
because they have just, um, gone through something that's hard, right? It's difficult, it's long, and yet they always are thinking of themselves last.
Yeah.
And so the only way I talk a lot about the only way we can show up for the people that we care about the most is if we're taking care of ourselves. And I saw this definition of self-care, probably about a year and a half ago that I use all the time because I think it is there's a word in it that's so interesting, and it is anything we do deliberately to preserve or improve physical, mental, and emotional health. And I thought this word preservation is so important. How do we make time to take care of ourselves so that we can be the person that we wanna be and show up for the people that we love the way we wanna show up for them.
Yeah.
So that
100%.
yeah, that preservation word really hit me hard because I do think that, it's not all about massages and doing your nails, although that's wonderful and it's great. How do we make sure that we're listening to what our body needs fuel-wise,
Yeah.
hydration-wise, getting outside for sunlight, getting the rest that we need, those kind of, the basics.
Yeah. Foundational, like even a shower, these new moms are like, oh, I didn't have a shower, in days. And it's like a warm shower can be so exhilarating for the body and the soul. And I think that's the other thing that as we're having this body conversation, I'm thinking about like, what is the purpose of our body? Our body's purpose is to be a meat suit for our soul, right? Like, that
Mhm.
is really why we're here. And so, if we really think about it, it's the temple, right?
Right.
And wow, what an amazing opportunity that we get to care for our temple because it's housing our spirit, which is phenomenal and never dies, right? It's ongoing, infinite intelligence and love. And so I think that is just such another wonderful reason to care for our bodies because our bodies are holding our spirit for us, right? It's a big job.
Yes. Yes, and they are the vehicle that we move through every experience we have ever had and ever will
Yes.
have. Like,
Yeah.
without them, we can't do anything that we do.
Yeah.
See a sunrise, rock a baby, feed a baby, watch a baby, laugh and giggle, all of those things. There's
Yeah.
a the term that I use, which is very similar to what you're talking about is body neutrality, and it is kind of circulating a little bit more, and when it comes to our body image, especially when you go through the whole transition of becoming a mother, trying to get pregnant, being pregnant, after birth, and thinking that things are supposed to look a little different and be a little different with our bodies, and yet how do we start to really think about them differently? And this body neutrality concept takes focus off of appearance and puts it on function.
Oh,
Look at the things that my body just did. this is amazing. How do I start to, if I'm thinking about the wonderful things that my body can do versus how it looks or the weight on the scale, it changes everything. It changes our whole outlook on how we feel about ourselves and our self-confidence as well.
Yeah, I think what you're speaking to is you're showing gratitude for all the amazing things that our bodies do, which it really is such an amazing organism, right? Like it has this innate intelligence to heal. We don't have to think about how to heal our body. It just happens intuitively and naturally. And it gives us information when things need support and help. And instead of suppressing those symptoms, we can listen to them, we can recognize them, and we can address them, right? And when we address these symptoms, that's where the healing comes full circle. And so when things are stuck with the healing process, it's a great opportunity to get curious, like,
Mhm.
why can't my body heal here? It has innate intelligence. What's stuck? And it could be an emotional belief, it could be a physical toxin, it could be so many things. But once we identify, and it could be multiple things, once we identify and rectify it, then the healing is happening automatically and very quickly, actually. That's the really also powerful thing is we get the blocks out of the way and healing is so spontaneous.
Right. You know what the wonderful thing about the work that you do is that you get women to tune into their body, and listening to their body is that's the first step,
Yeah.
right? Is how can I actually listen and start to respect what my body is telling me? You know,
Mm.
that little voice that says, "This doesn't feel right," then we just kinda push aside and ignore because we have all these other things to do, and we're supposed to be doing this, and I shouldn't be feeling this way, or we just kind of brush it aside. And so this learning to pause and slow down and be in tune and in touch with our body's natural wisdom takes time and takes patience and it takes practice to be able to do that. And the voices in the head try to try to avoid you from doing that. They keep it really loud up there, so we
Mhm.
miss some of the signals.
Well, really listening to our body and our body's wisdom is, I think, it's something that we're born with, and then we can tend to forget about it, or, like you said, kind of push it aside. But I do find that when I'm adjusting children in my practice, they get really good with listening to their body. I also see this with athletes.
Mhm.
Um, And then when they come in for chiropractic care, I have, 10-year-olds that are like, I need you to check my right ankle and my left wrist. And, like they're really aware of where things are out of alignment. And they are able to use their body at a different level because of that. They have stronger immune systems because they're like, okay, I need to get in for an adjustment. Things aren't working well, and they get adjusted and then they don't get sick, right? Or they're, for my elite soccer player, I'm thinking of like he's getting adjusted regularly because he knows he's putting his body through so much and he's really looking to prevent injuries and he's looking to have a long career doing this type of work. So, right, that's what's so cool when we have that connection with our body that we can really understand what it needs. We see with babies when they're starting solids, you put out different types of foods for them to grab and they will grab the foods that have the nutrients that their body needs at that moment. And
Mhm.
it's unconscious, right? It's like, okay, I need some extra iron, so I'm going to grab that piece of steak, right? Like, or I'm a little low on vitamin A, let me grab some sweet potato. Like that's what a baby will do. We can do the same thing if we just tap in. What is my body lacking nutrient? And that's the type of foods I want to be putting in for fuel right now.
Right, you know, it's very true. That's what when it comes to eating and food, there's a lot of belief systems around the good and the bad and the morality around food, and that's what intuitive eating talks about too, is tuning in, and the once we kind of take away the morality and just say food's food, let's start to listen to how a food reacts in our body. How does it
Mm.
feel in our body? How do we feel after we eat it? What does that feel like physically? Then what does it feel like emotionally? Do you wanna just go take a nap? Are you snappy? Like, really tuning in to our body and the way it responds to food. That's kind of this intuitive eating approach isn't like I intuitively want a cookie and I'm gonna eat it. It's more about how do I be more in tune with my body and what it actually needs and how it feels pre, before, during, and after, you know, the the nourishing of the body.
Yes. And I also think see that really plays a part in like food sensitivities, food allergies, because if you're really in tune, when you eat a food afterwards, and it could even be a little bit delayed, but you'll be like, you know what, that food, didn't really work well in my body. And it's an awareness, like maybe I'm going to put that food, like if it's dairy, gluten, eggs, whatever it is. It's not like a big allergy, but it's something like I'm going to just take that out of my diet, at least 3 weeks, maybe a little longer, and we can kind of reset, heal the gut, and then when we bring these types of foods back in, they can actually be nourishing for our body, right? These clean, sources, and they, don't have to be an ongoing food sensitivity for the rest of our life if we have an awareness, but if we're eating it every day, multiple times a day, then it's just creating inflammation and it's not going to be healing and fuel that our body's actually looking for. So it's cool how food can be, something that creates inflammation. And then even with a pause, 1 month, 3 months, whatever it is, then we can bring it back in and it can actually be healthy for us. Right. And so like that's also an awareness, like at different life cycles and things can change, right?
Absolutely, and I think that that's so it's interesting how if we allow ourselves to take that time to say, "You know what? This food doesn't feel right now," it becomes a choice rather than a should or a shouldn't, and I think unfortunately with dieting, it's like, "This you cannot eat, this you have to eat."
Oh,
Right? And so sometimes, if people have dieting history, that's the way they approach dieting, is, "I
oh,
can't ever eat this ever again,
oh,
but I need to be eating these." How do we kind of release some of that and go, "You
oh,
know what?
yeah.
That food really doesn't agree with me,
Yeah.
so I'm choosing to not have that particular food for a while and see how
Yeah.
my body does,
Yeah.
versus I shouldn't eat it or I should eat it."
Got it.
Yeah.
That is a really interesting point. I'm a fan of 80/20 rule because I love eating clean and I love how I feel, but I also love having some sweets, right? A piece of dark chocolate or
Mhm.
gluten-free cupcake or something like that. And so recognizing that I do choose to, it's a choice. I choose to bring in some sugar because it brings a lot of joy and
Mhm.
happiness in my life. But I certainly want to eat that 80% of the time because I would feel pretty crappy, right? So I
Right.
do think that balance is really important. And I think that's also important to model for our children as well, because recognizing that it is fun to enjoy food and
Mhm.
foods that are even maybe not the most healthy foods, but we're having them as, a treat or a dessert here and there, um, because of the joy aspect.
Right, and it makes for there's socialization that goes along with that too,
Yeah.
and it's not that you can't have it.
Right.
So I love the 80/20 rule. I use this term mostly sometimes if I mostly eat like this, and
Yes.
sometimes I have something like this
Yes.
because I enjoy it and I love it and it's one of my favorite things,
Yes.
great.
Yes.
The flip, certainly not gonna work for a lot of people.
Correct.
Right?
Right.
Yeah.
So, I wanted you to talk a little bit about, the book. I think you
Mhm.
in one book now, but is the main one The Body Joyful that
Yeah, The Body Joyful was I published that in 2021,
yeah.
and that's my story of, body shame, eating disorders, disordered eating, and my way out. And then most recently, I just published the Body Neutrality Playbook, which is kind of a workbook around body image. So it's
Mm,
everything that I have the work that I've done with the clients the people that I work with and the groups that I work with around body image, everything that has worked for people, I have put it together in a kind of a workbook setting so that people can take what they like and leave the rest and try to start to heal the relationship they have with their body because it's the one relationship we have our whole lives,
yeah.
right from start to finish. And we weren't born hating our bodies.
No,
Babies love their
you
bodies.
love
You
them.
know, we were kind of taught and we learned to hate them, and so how do we unlearn that and
Yeah.
start to be more curious and more kind and more intuitive around these bodies that we will be living with as we get older.
Yes. Yeah, I mean, that's a whole nother conversation, right, with the aging process.
I know. I know. I know.
Mm.
As a grandmother, I yes.
Things change, right? And I think that's the other thing with life. When we expect things to stay the same, we just are going to create a lot of pain for ourselves. Like that's
Mhm.
one thing that's constant is change, right? And so, really, embracing these changes, even for women I'm working with that are going through perimenopause, the same thing, right? Things are changing in our bodies, the way they function, the way they look. And this is
Mhm.
a normal part of the woman's life cycle, right?
Yeah, if you think especially if you think about, a woman from childhood through adolescence, puberty,
Yeah.
and then into motherhood, and then also into the workforce if that's, or both things at the same time, and then we move into menopause and then postmenopause, and there's just a lot of our body is constantly changing, and so how do we just build ourselves a more compassionate and caring and confident relationship with our body that we haven't always been so nice to.
100%. Do you have
Mhm.
any last thoughts you wanna share with the audience?
I just wanna say thank you to all the moms out there for the work that they do. They work hard all day long. I don't think they get the credit that they deserve. So, so thank you for doing the work that you do, and thank you for listening and being the mom that you are for your children. Just continue to talk nicely to yourself as you do.
Mm, well said. And how can people find you?
They can find all my books on Amazon. I do have a tween book too that talks about body shaming and weight stigma.
Oh,
So, yeah, so my journey, from my own eating disorder has really paved the way to create a mission to change the way we think about bodies right from the start. So you can find my books on Amazon. And then I also have a free gift for any of your listeners that if they would like, it's the Body Confidence Unlocked e-guide, how to feel at home in your body no matter size, shape, or age. So I'll send you that link, and people can get in touch with me through that as well.
I'll put it in the show notes. And then your website is shapingperspectives.com,
Yes,
so they
that's
can find out
correct.
more about you from there as well.
Yes. Yep.
Awesome. And thank you so much for coming on the show today.
Thank you, Dr. Laura, for having me. I appreciate it.
Well, I hope you enjoyed today's show. Anne is such a powerful voice for the body neutrality movement. And she has such a passion and wisdom that comes with helping us as women learn to love our bodies and really the importance of why we need to practice self love for ourselves and our bodies. If you want to learn more about Anne, you can check out her website at shapingperspectives.com. You could also follow her on Facebook or Instagram at Anne Poirier. And additionally, if you need extra support and guidance with your own personal health journey, I'm here to help. I have a virtual functional medicine practice that has now launched, and I specialize in preconception, fertility, and women's health. If you want to find out more, please go to my website at drlaurabrayton.com. Click Become a Patient to schedule a complimentary 15-minute discovery call with me to see if my program is a good fit for you.